Good afternoon, everyone, and welcome to our webinar. Stella Kyriakides, the European Commissioner for Health and Food Safety, took time this afternoon to join us and to deliver the opening speech.
The feeling that I had was this amazing energy that came from everyone that spoke. And it comes from turning a personal experience into a political experience, into using a personal experience to bring about change. In our team, in this commission, in this college, and in myself personally, you have a strong partner.
We all know, the people who are here, that there is 500,000 people like us in the EU.
We said we can only do this together as the big communities that we are having already in place in joining and gathering strong partners across Europe.
So that this is not just a one-off event that we go, but we are a community and we are able to stay in touch with each other.
The topics that this project addresses are grouped in three big baskets: quality of life, adolescent and young adult cancer care, and equity, diversity, and inclusion.
Therefore, in this work package, we want to raise awareness to the importance for mental health and psychosocial care in the survivor community, as well as also for healthcare professionals.
We focus on two types of transition. First is the transition from child-centered to adult-oriented care, and the transition from follow-up care to long-term follow-up care.
For us, it's very important that we have the peer visits in Europe because we can see how IA care is implemented in other countries, in other European countries.
Come up with a toolkit and training modules for many stakeholders that includes patients, community organizations, healthcare professionals, researchers, educational institutions, and many other parties that are really interested in the EDI, right? Equality, diversity, and inclusion in cancer care.
So all these activities will then assist at the very end in the development of a minimum of standards of care paper that will ensure that all IA patients, irrespective of their location, socioeconomic status, or condition, receive a defined baseline level of care.
So being able to do research as part of this project that really does have co-production in it, which is fantastic, that spans all of Europe, that gets insight from the ground up from the patients and gets their view of EDI as well, is going to be so instrumental into making sure we can make strong recommendations that improve patient care.
Even though the community is ongoing, which is really great, and even though people who were not involved at the very beginning are jumping in and are really pushing our agenda forward.
I think the first and foremost important thing is that I can also learn from others. So we have a great community with a lot of patient advocates who have experience in advocating for AYAs.
And that actually this ecosystem exists where someone is listening to the patient, that it is not just you are as a service receiver coming into the hospital or to the clinic, but that actually there is a whole movement how to empower the patients and carers, and there is a lot to share.
So what we said from the very beginning, and I think I'm quoting from somebody, we do not want this project to become an elitist network. These are the beautiful, wonderful faces of those who so far have signed up for our ambassador program, and you can too. We will be sharing a QR code later on, so if you would like to be part of this community, then please let us know.
We welcome everyone, so siblings, carers, but also the healthcare professionals. So you may not be ambassador in the field, but you may have an interest to work on a certain topic. You know, you may be working on a publication, but instead of just seeing it from the lens of desk research or something you see from analyzing the data, maybe it is better also for your professional careers to see it from the real people with real stories, to understand real passion, and then to see what can be done together.
So I think if you have the feeling that you have so much to say, stemming from your personal experience, maybe seeing what your peers are experiencing also. If you see, hey, this is just not working as it is and this needs to be changed, then just take the step and do, and be assured that there is a network that will support you and that will welcome your inputs and your willingness to help facilitate change.